Falls are a common and serious health threat to adults 65 and older. Every year, more than 1 in 4 older adults falls, but over half of those who fall won't tell their healthcare provider. Many of the risk factors for falls are modifiable, and pharmacists, as members of the healthcare team, play a critical role in fall prevention. Welcome to STEADY, the pharmacist's role in older adult fall prevention. This activity is a free continuing education opportunity made available through a partnership between the Centers for Disease Control and Prevention and the American Pharmacists Association. At the end of this application-based activity, you will have the opportunity to earn 1 hour of CPE credit. To play the training, click the play button. You may pause at any time and can navigate using the forward and back arrows as available. Your progress will display in the colored bar at the top of the screen. To turn the closed captions on or off, click here. Information on obtaining continuing education credit is located here. We also encourage you to review the links and materials under Resources.
Module 1, Introduction.
In this activity, we will present how falls are affecting the health of older adults and the steps pharmacists can take to improve patient care, prolong independence, and ultimately save lives. After completing this activity, pharmacists should be able to describe the burden of falls among older adults, identify health conditions and types of medications that increase fall risk, implement fall screening, assess risk factors, and offer prevention strategies, and discuss strategies to improve patient care coordination for fall prevention.
The preventable problem.
In the United States, every second of every day, an older adult falls.
Dr. Judy Stevens.
In 2014, almost 3 million older people were treated in emergency departments for falls, and about 20% had to be hospitalized, often for head injuries and hip fractures. And this represents a 66% increase over the last decade. Now, people are living longer, and they're often living with chronic conditions like diabetes and arthritis, and this can increase their risk of falling. So we expect this problem is going to increase as time goes on.
Not only are falls and the resulting injuries a serious threat to the health of older adults, they are costly. Annual medical costs for falls surpass $31 billion in Medicare costs alone. At this rate, the burden will substantially increase unless we recognize the problem and focus on prevention.
Research has found a number of ways to prevent falls, and these are things that pharmacists and other clinicians can do to help their patients remain healthy and live independently.
The STEADY Initiative.
When pharmacists help patients improve their medication use and reduce their risk of falls, patients stay healthier and overall healthcare costs are reduced. To help healthcare providers implement fall prevention as a routine part of care, the CDC developed the Stopping Elderly Accidents, Deaths, and Injuries, or STEADY, initiative. Based on the American and British Geriatric Society's clinical practice guideline for the prevention of falls in older persons, STEADY provides members of the healthcare team with the tools and resources they need to reduce their older patients' fall risk.
Dr. Julie Gilchrist.
The role of pharmacists has been expanding. They do everything from immunizations to blood pressure screenings. And since medication review is such an important part of fall prevention, they're really uniquely qualified to make a difference.
As you provide services like chronic disease management and other wellness services, you can reduce your patient's fall risk.
Dr. Julie Gilchrist.
Pharmacists are really motivated around patient safety. And with their unique set of skills in medication review, this is a great opportunity to further collaborate and coordinate to keep our patients safe.
Dr. Corey A. Canelti.
My role as a pharmacist I see as expanding beyond dispensing medications. It's medication therapy management, increasing the patient's self-efficacy, and working with the entire healthcare team.
Dr. Randy P. McDonough.
I see my role in patient care as being an advocate for the patient as it relates to their drug therapy. I want to work collaboratively with the other healthcare providers. I really believe the pharmacist's role should be to identify and resolve drug therapy problems. I've always said and go out and promote to pharmacists that the 3 questions we should be asking patients each and every time is, have they reached the therapeutic outcome? Is their medication safe? Is their medication effective?
STEADY encourages healthcare providers, including pharmacists, to screen older adults for fall risk, assess modifiable risk factors, and intervene to reduce risk. This process is in line with the Joint Commission of Pharmacy Practitioners, or the JCPP, Pharmacists' Patient Care Process.
Graphic appears on screen of JCPP process.
To begin preventing falls, screen patients by collecting information to identify older adults at increased risk of falls. Assess patients to create a plan that optimizes therapies to reduce risk. Intervene by implementing your plan and providing appropriate education and referral. Finally, document and follow up to improve patient care coordination. Fall prevention can be incorporated as a routine part of care.
Dr. Corey A. Canelti.
We incorporate fall screening into our workflow by creating a protocol, making sure everybody's on board with the protocol.
Dr. Randy P. McDonough.
We have utilized certain processes so that we can identify potential issues that are occurring with patients before they become issues. And we want to actually be proactive and put information into the patient profile that might be questions we need to ask the patient to make sure they're not having problems.
All pharmacists that provide care to older adults have an essential role in fall prevention, no matter their practice setting.
Sunny Lineber.
Pharmacists in the ambulatory setting are really in a great spot to be able to help reduce falls in their patients. First, they're collaborating with providers and they have direct access to the patient's electronic medical records. So a quick review of their medications can allow that pharmacist to make recommendations to the provider about which drugs may be increasing the patient's fall risk or which drugs could be modified or reduced in order to reduce fall risk.
Community practice.
Pharmacists who work in the community are seeing those patients face to face, and if they feel that the patient is presenting with a wobbly balance, for example, or seems a little bit sedated, those pharmacists have a great opportunity to interact with the patient, to ask questions about their fall risk, and also to review the medications, and then still provide that feedback to the patient, but also the feedback to the provider, maybe over the phone.
Transitions of care.
Pharmacists who are in the discharge setting, who are sending patients home from the hospital, have a great opportunity to improve their patient's health care by following up with the primary care provider if the patient was, for example, admitted for a fall or came in with low blood pressure or some other condition that we know increases fall risk. What they need to do is make that extra effort to communicate that admission and that concern of the inpatient team to the patient's primary health care provider, so that primary care provider can then follow up on that and identify if that is something that the patient could in fact be at risk for in the future, and if there are any modifications that need to be made.